Hi, today's question is, what are the chances of having shock loss after a hair transplant procedure? Now, technically there's two types of shock loss someone can have involving a hair transplant procedure. The first type is shock loss of the actual transplanted hairs. This occurs in greater than 90% of the patients, and more than 90% of the grafts actually go into shock, where the little follicle sheds the hair and you have to wait the 3 or 4 months during the sleep cycle before the follicle generates a new hair. So that's shock loss of the transplanted hairs. Now, anytime you're doing transplants in between any native original hair, there's the chance if any of that hair is very weak and thinning and going through the hair loss process, it may actually shock within a few weeks after the procedure. Now, sometimes this is temporary and sometimes this is permanent. If it's a healthy hair, it'll grow back probably around the same time the transplanted hairs will come in, around 3 or 4 months. If it's a hair that was on the verge of falling out on its own, whether or not you did a hair transplant or not, that might be the final stress that pushes that hair over the edge. But don't forget, you're going to be replacing that with more permanent hairs from the donor area.